Hello, everybody. Now, as we're just jumping on and getting the tech to work, hi, everyone. It's some people from Sydney, Melbourne. We've got some rural people on the call as well, which is really exciting. You just jump in the chat and let me know that you can see me, you can hear me, and that the technology side is all good? Because I'd hate to just start rolling on and then a few minutes later, everyone's like, Katherine, I can't hear you. So if you could just pop that in the chat, I would really, really appreciate it. And then we're going to get stuck in just one moment. Excellent. So technology. Okay. Yep. Can see you, hear you. Great. There's a slight delay in comments. You can ask any questions at all throughout this masterclass. But what I'm going to do, just for the sake of time, because I've got a lot of stuff that I want to share with you tonight. Thanks, everyone. Fantastic. Is I really want you to post anything. It can be personal. It can be like a question about your own health or a diagnosis or anything, right? Nothing's off the table. But what I'm going to do is I'm going to go back and I'm going to answer them later. Because the comments are slightly delayed, but it's just going to keep the flow going and mean that we can really get into the content, and then I can come back and I'll answer your personal questions first. So thank you so much for being here with me this evening. We're going to cover a lot in this hour, and I might go a little bit over. I'm going to make sure I get to all your questions, but we're going to cover a lot. I'm going to talk about how endo happens, why endo happens, what the research is showing currently, so some of the newer stuff that's coming out and what that means for you. I'll talk about the medical approach versus the naturopathic approach and how it's different and how you can integrate both of those. And of course, always on my masterclasses, I want to give you some practical tips on what you can do to help yourself with your endo. Now, some of you know me. Some of you are brand new. So before I get started, I want to just start with introducing myself and letting you know a little bit about me and my story so you can understand where I come from. So I am a clinical naturopath, nutritionist, author, host of the Shift podcast, which I'll talk to you guys about. I'm also an elite coach. I work with businesses, organizations, and individuals to incite change and work on things like their values and their belief systems. And I'm the founder of Shift Clinics, which is an international wellness organization where we help people to shift their health and their life. So I'd love to let you know a little bit about my story. And the reason I do this, I want you to understand the lens in which I'm looking at when I'm giving information, the lens that I'm looking at when I'm talking about how I manage patients through this process, because this is very different to the conventional way that things are done. So I am from Melbourne. This is Flinders Street Station in Melbourne, and I grew up with a pretty tumultuous childhood. So my father was an alcoholic. There was a lot of abuse in the household, and it was a tough time, right? So before I knew it, I was 15 years old. I was homeless. I was addicted to heroin, and I was living on the streets of Melbourne City, right? So that's sort of where my beginnings came. Very, very fortunately, I was lucky. I was on the streets of Melbourne. The Salvation Army picked me up off the streets. They put me in a halfway kind of house for girls. And it was there that I received a phone call from my best friend. And she was like, Kat, we're moving to far north Queensland. So her mum was extracting her out of Melbourne and moving her to the Daintree rainforest. And she said, would you like to come with us? And that one decision completely changed my life. So at 15 years old, I packed all of my belongings into a backpack. I got on a Greyhound bus, for those old enough to know that that was the mode of travel back then. And I moved to the Daintree rainforest across the ferry, if anyone's ever been up in Daintree. So this was really transformational for me. And it taught me a few things. That environment is really important for your ability to heal. I was living in a house without electricity, without hot water. So it was very humbling, but I was immersed in nature and obviously in a very different environment. And as luck would have it, as you're in different environments and places, I met a family up there, and this family was called the Penns. So Robbie Penn, this guy here, he wore a crocodile tooth on his neck. You can probably see that. And he considered himself to be a bit of a pirate, right? He was a pommy. He had this, bit of short man syndrome, and he was like, arr. So he was a real character. But his wife, Jenny, was the sweetest, most beautiful woman that you've ever met. And she became a second mother to me. So I'd sit around her table and drink cups of tea with Jenny, and she would talk about all kinds of things with me. And the issue was that Jenny was very, very sick. She had a progressive autoimmune disease called lupus. And what that meant was that as I knew her medication cabinet grew and grew, but she got sicker and sicker. And I'd never really known anyone that was truly unwell. In my family, we had a lot of mental health and obesity, but I never knew anyone that was really properly sick in that way. So Jenny was really special to me. And as it so happened, I stumbled across a book on herbal medicine, and I read about herbs and all these different things they could do in the body. And I just thought to myself, why doesn't everybody know about this? Something that I still think today. And it made me really passionate about it. So I packed up my mini moke, my first car, if anyone knows what they are, and I drove down to Brisbane, and I enrolled in a Bachelor of Herbal Medicine and then a Bachelor of Naturopathy later. Now, unfortunately, I think I was in my second year, I got a phone call one day on campus, and it was from Bonnie's daughter, Jenny's daughter, Bonnie. And she said, Kat, Mum's passed away. And I still remember that moment and where I was, because it absolutely devastated me. I'd never had anyone really close to me that I'd lost. And I think it really strengthened my resolve to go, we've got to do better by people. Jenny was 46 years old when she died. And it doesn't have to be that way, right? So I think a little piece of Jenny carries through in everything that I do. She was a wonderful human. So fast forward 25 years later, I have a business called the Shift Clinic. So we have a team of 15 people. We've helped over 15,000 people through our doors in our 15 years of business. I've been practicing for about 20 years myself. I wrote a book called Get Well, Stay Well. I'm currently writing my second book, which is called Safe to Heal, which is all around how do we as women get safety in our bodies in order to be able to heal. And I've got a podcast called The Shift, which season 2 is women's health. This is a really good next step for everyone after this masterclass. So if you want to learn more and go deeper, this podcast, it's not just a general interview-based podcast. It's a highly produced documentary series all about women's health. So I really highly recommend you go and check that out. So these days, for me, I still do a little bit of client care. I do a lot of consulting. I help to manage and mentor and support the team that we have at the Shift Clinic, but I also like to do a lot of this. So a lot of educational stuff. I do quite a lot of international and, well, not as much international these days, but quite a lot of speaking. And also at the moment, I'm creating an online version of our membership. So at Shift, we're quite unique in that we do these natural health memberships. And the way that we look at health is really understanding what is the landscape of the entire health. What are all the parts that make you you that have led you to be exactly where you are today? And when we think about something like endometriosis, it's so important to understand this entire landscape and not just do one thing here or there, because it's a very complex, very multi-system condition. And it's one of those conditions where it's difficult to treat because it's so entrenched in your tissues. You know, if I had a rash on my skin, it's kind of surface, yeah? Like I can work on it and change the physiology and it will resolve. When you have deep infiltrating endometriosis, it's almost like a cancer in a way that it's worked its way into your tissues, and it can be difficult for the body to heal that by itself. So what I want to talk about in this masterclass is I want to talk about how do doctors look at it, how do we look at it, and maybe how do we blend the two? Because a lot of the times with endo, you will need that medical care, but often it won't get you all the way in resolving or keeping you in remission. But if you add the naturopathic stuff on top of it, then often that can lead to a lot of success, and it can be a really, really good approach and way to go. So a little bit of physiology before we talk about endo and what it is and what it does. So if we have a look at the uterus here, the uterus is not very big. Okay, this thing that causes women so much drama is smaller than the size of my fist, significantly so. Like it's very, very tiny, right? It's smaller than you might think. So we've got here the uterine wall. So in this uterine wall, we've got endometrial lining, and this is where every month you have the buildup of the lining to support a pregnancy and the shedding of the lining. That's your period, right? Then we've got the ovaries over here, which are actually not attached to the fallopian tubes, and in fact are probably kind of floating around here somewhere. You've got the cervix, you've got the vaginal cavity, etc. So with endometriosis, the cells that are in here are growing outside of here. And it used to be thought that that's just what they were. But what we know now is that they don't really stay that way. So it's like endometrial lining like cells that are growing in places outside of the uterus. So it could be anywhere in the pelvic cavity. On the outside here, it could be around the ovaries, like bladder, bowel. They're the most common sites, right? Because it's really local. But we've found endometriosis in the brain, in joints, in the lungs, in the pleura. There's been quite a few people where it's been found here and in the diaphragm type area. And this has really led researchers to go, all right, well, we need to look at things a little bit differently, because it used to be thought, and see how the fallopian tubes are open. So what that means is when you get your period, there can be a certain amount of leakage that comes out of here, right? Maybe not always, but it's common. We know this. It's called retrograde menstruation. And it used to be thought that's it. The cells come out and then they just implant. But we're really starting to rethink this. What are all the different things that we need to have a look at as part of this picture? So it can be anywhere. Here are some of the common sites, and it can show up really differently on imaging as well. So you can see here, these are sort of like lesion type growths, but you can have endometriosis that's actually really, really difficult to detect. And this is where one of the biggest things for endo is the shortage of surgeons that actually know what they're doing, because with the surgical approach, not only does it need to be diagnostic, so they need to know what they're looking for, but it's a treatment. So they find it, they need to know how to deal with it. Are they going to cauterize it? What's going to happen? And that side of the approach. So we need to, look at this condition that it's very complex. It's been hardly researched, really, when you think about it. And we're just there's really a lot more talk about it. When I graduated in 2016 or 2017, I built my practice on doing not masterclasses, I didn't call them back there. I called them workshops, and I did a PCOS workshop and an endometriosis workshop. And I would hang posters up at the bus stop, with those little tear off tabs. Do you remember those? And that's how I built my practice. And I would do it at the local library and get a free room there. And I was absolutely shitting my pants at the time, right? I was not a great speaker back then. I thought everyone hated what I was saying, but, I've been doing this for a very long time, and what we know now is not really remarkably different to what we knew back then. Yeah. And it's just because the drive on the research just isn't there. And we're starting to now hear about this and get more groundswell behind it. But then we've also got stuff that's going on in the US where they're cutting funding in women's health, etc. But there's a lot of really good research going on in Australia. Absolutely. So endo can occur anywhere, but it's going to be the more common sites there. Ovaries, fallopian tubes. The pouch of Douglas is a little part that's kind of between the vagina and the rectum, kind of sits there. And that's a really common site for endo. This is why often with intercourse, you can get pain with endometriosis. It can happen even on the cervix. So if people are bleeding after intercourse, that's a big red flag for me to get endometriosis assessed for them as well. There's a lot of ligaments in the pelvis that's holding everything there. Endo can happen on that. It can then turn into scarring and adhesions. The worst case I've ever seen was this poor woman, and she went to have surgery, and the doctors were like, it's so bad in there. We literally cannot do anything for you. We can't cut anything. We can't move anything because everything is like completely glued together. So our role for her was just to try and manage pain, quality of life, and see if we could get some symptom relief, because the surgery was not an option. Yeah. So it was, there's some, and they couldn't even do a hysterectomy. It was that bad. So there's some pretty bad cases out there. Okay. So you can get weird stuff going on. You can get these cysts that form, often on the ovaries. So a chocolate cyst is basically, it's a cyst, but it's filled with endometrial tissue. So every time you bleed, the cyst fills with blood, and then it dries out and it turns brown, yeah, because it's like dead blood cells. And imagine the excruciating pain you're going to experience when this cyst that's filled with old, congealed, gross blood spills into your pelvic cavity. Yeah, and that causes incredible pain. Women ending up in in the emergency department, stuff like that. So when there's endo going on around the ovaries, pain with ovulation is a really common sign, but you could also have other things. It's not like endo just happens on its own. You could have endo and fibroids, endo and ovarian cysts, endo and adenomyosis as well. So, it's complex sometimes. And I think it's important too that we need to get a full scope of the picture. It's not like, okay, well, you have endo, so that's just the cause of all your problems. Okay, but what about the other stuff that's surrounding it? So the symptoms, pain is the number one thing, but sometimes you can have endo without pain. And the reason we know this is when someone's suffering from infertility and they have failed IVF cycles over and over, often what the doctor will do is order a laparoscopy to have a look. And often these women will have some endo showing up, but they don't have any pain or symptoms, right? So there's definitely a correlation between the endo and symptoms, but sometimes it may be there and it's not causing us many problems. Periods can be weird. They can be heavy, clotty, absolutely. More pain, maybe mid-cycle pain, maybe pain with intercourse. Infertility might be the first time it shows up, and it can kind of whack your hormones and how you're feeling leading up to the period as well. Non-menstrual symptoms, stuff to do with the gut, and especially if there's endo on the bowel, right? So if you've got endo on your bowel there, you might actually get pain when you pass the bowel movement, or you might get more constipated around that time. And what I find from just treating thousands of women with this condition is that when there's inflammation in here, it's like everything in there gets really sensitized. So I've got one patient for endo, and her biggest trigger is getting constipated. So our number one thing for her is to stop her from getting constipated, because if she gets constipated, it blocks everything up. It's almost like there's a guarding or a tensing of the abdominal area, and then it gets more inflamed, and then it triggers her endo symptoms like crazy, insane. So the bowel definitely has a bearing. Same with bladder. If you get a UTI, that can flare up endo symptoms as well, right? Or vice versa. Sometimes insomnia, especially if there's pain involved, those high pain cases, there's a link between endo and anxiety and depression as well. So there's this real landscape that we want to have a look at. So when we're treating endometriosis at the Shift Clinic, it's about what's your landscape, yeah? Not like what are the endo things. It's like, well, what are the bits that are showing up for you that are more important? Because we have so many effective herb supplements that have lots of research evidence. We can't give you all of them. You'd be on 40 tablets. We really need to hone in and go, which of these things are going to work best for you? So our philosophy is we want to get the fastest results with the least amount of supplements, but also within the best budget that we can as well. It's just harder than it sounds, but it's something we're very good at. Been doing that for a very long time. Risk factors. We know that if you get your period earlier, you're more likely to get endo. Has anyone noticed the trend of menarche, of us getting our periods coming earlier and earlier and earlier? My daughter got hers start of 12, I think, maybe end of 11. But the other day I had a patient, she was 9, got a period. There's cases, there's precocious period where it's like they're really young, but definitely kids are getting their periods earlier and earlier. And it sort of becomes hand in hand when you look at the risk factors of why are women getting all of this endo, PCOS, fertility stuff. A lot of it has to do with the amount of chemicals we're exposed to. So we know from the data that these chemicals are associated with earlier onset period, but also increased risk of endometriosis and also increased risk of early menopause, right? Periods that are heavy, long, family history definitely comes into play. There's a lot of studies around genetics. I'll show you some of that stuff later. Just really briefly, because when we're looking at this picture, if either laparoscopy is done and there's no endo, it could be adenomyosis. And this essentially is same kind of cells, but they're growing inside of the uterine tissue. Much more difficult to treat from a medical perspective because they can't excise it and get it out, right? So we see a lot of patients like this that they want to have babies, so they can't get a hysterectomy. So they come to see us because like, well, I can't have surgery and I don't want to be on drugs because I'm trying to get pregnant, right? So we can really come in and try and bridge that gap a little bit as well. Some of the drivers for endo are the same for fibroids and adenomyosis, which is congestion, high estrogen, inflammation, and maybe immune stuff as well. Fibroids, as we age, happen. Yeah. So as we get 40, 50, 60, most of us will have some fibroids before we die, right? It kind of can happen. We know that that can happen. But the problem lies when they start causing issues, symptoms, heavy bleeding, etc. So this will just get ruled out in the dues of investigation. So the gold standard of investigation for endo is a laparoscopy, but you can now do a deep infiltrating endometriosis scan. Not many people know about them, but it's an ultrasound, but it's done in a specific way with specific criteria where they can get a pretty good feel on if there's endo present, if it's decent. Yeah. Like if it's moderate or above. So that's been a godsend for a lot of my patients. And I'll talk about what they're looking at with future stuff here too. How does this happen? So I talked about environmental toxicity. I think that's a really big driver. But the thing with endo is we don't know. Well, we sort of have an idea, right? There's this group of things that we know from research are contributing factors, but really in the medical world, there's no cure and there's no cause, because even if you have a laparoscopy, the recurrence rate is really high. Okay, so, or, you know, even if you get a hysterectomy, I've had patients that still get pain because they have residual endometriosis in there, right? So for some people, they'll go into remission and they'll resolve it. But for a lot of people, this is a lifelong over and over and over again situation. So in the past, they thought it was just because of retrograde menstruation. And now we know there's a lot of things that are a bit weird about women with endo. And one of the biggest areas is the immune system. So the immune system for women with endo is a little bit different. So think of it this way. If you have a foreign tissue growing somewhere it shouldn't, so if there's endometrial-like cells in the pelvic cavity, the immune system should see that and go, that doesn't belong here, and actually clean it up and get it moving and mobilized. But it doesn't. It doesn't do that, right? So there's been a lot of research in this area, and there's going to be the next 5 years, there's going to be this huge influx of research in endo now that we're starting to do research on women. Okay, so we know that we've got reduced T regulatory cells, which promotes lesion growth. So these cells would normally regulate stuff and go, hold on, that doesn't belong there. Okay, so that's something that we know that happens. It causes angiogenesis, which is basically like it gives it blood supply so that it's able to grow and thrive a lot better. Makes it worse, essentially. We know that they've got impaired innate immunity and natural killer cell activity, increased pro-inflammatory cytokines. So these are basically just inflammatory cells. And there's also the presence of autoantibodies like ANA, etc., more common in women with endo. So look at this. This is from April 2025, and it's a study that showed that there's a genetic link between endometriosis and immune conditions. So women with endo were found to have a 30 to 80% increased risk of developing autoimmune diseases like rheumatoid arthritis, MS, celiac, and autoinflammatory conditions like osteoarthritis and psoriasis. That is huge, 30 to 80%. Okay, so this is where is endometriosis an autoimmune? I sort of treat it like it is in my practice. The evidence there really shows that that's something that we need to look at. So this is where I think treatment-wise, we're going to get some really interesting studies and things coming out with that too. Inflammation is a really big part of it. So think about inflammation. If I burn myself and it gets hot, it gets red, that's inflammation. And what it is, it's all of the cells are getting recruited just to clean it up and heal the area. Those same type of cells in chronic inflammation, it's like they're at high levels. So it's like inflammation driving inflammation, and you end up in this vicious cycle. So at Shift, we have we use certain manufactured fish oils and different herbs that have been shown specifically to break the cycle of chronic inflammation. And that can be really, really beneficial for pain for women with endo. But yeah, think about it, right? This is endometrial-like tissue. It's influenced by hormones. So progesterone stabilizes the endometrium. Estrogen grows blood vessels into the endometrium and into the tissue there to kind of feed it, if you will. And then when you bleed, when that progesterone drops off, you get this bleed. So you can actually get internal bleeding. And that's going to then cause a lot of pain, right? So it's like the tissue's active and it's moving, it's shedding, and it's changing with these hormonal changes. So yeah, it's a big deal. What you're feeling is absolutely real. Chantel, oh my God, is this why I have psoriasis all over my head? It's like, think about It's more like whatever's inside of you, like it's whatever you've started with, that leaves you more susceptible to the other things. Yep. So it's like the same blueprint has led you to the psoriasis and led you to the endometriosis, right? And I'll talk about how gut feeds into that too. But if we look at it from a root cause perspective, a lot of the conditions that people get stem from like a core thing. So, and that's one of the real things with naturopathic principles that we look at. Yeah. So for actually the treatment for psoriasis and endo has a lot of overlap in the treatment that we would use. Same if I have patients with endo and allergies or endo and asthma, a lot of the interventions cross over because they're modulating the immune system, they're reducing inflammation. So we have some amazing medicine these days compared to when I graduated 20 years ago. The things that we have and the technology around it, they're high dose, they're super absorbable, they're really, really, really impactful. So what else do we know from research? Women with a history of infection in the vaginal and reproductive areas are twice as likely to develop endo. So if you've had chlamydia or gonorrhea or something like that, twice as likely to develop endo. Women with endo have more lipopolysaccharides in their menstrual blood, which are pro-inflammatory, right? So there's these abnormalities. It's not just something that's happening for no reason. Trauma. So this is something we talk about a lot at the Shift Clinic. And in fact, half of our team is emotional wellness. And the reason for that is there isn't a patient that has a significant chronic condition that doesn't have some element of trauma in their past, whether it is childhood trauma stuff and things like that, or just trauma of the result of having this condition and being gaslit and not listened to. The amount of women that we see at Shift where they're not safe in their body because of what's happened to them in the medical process is just astounding. Like I had a client the other day, and I had to send her for hypnotherapy because I actually needed her to see the doctor, but she just refused. She's like, no, I don't do doctors. And she told me all the stories of what happened. I'm like, I get it, but we also need to go and get this medical investigation done and have that side of the story as well. So there's research on this, okay, like quite a significant body of research actually. So this is a more recent one that looked at the genetic analysis of traumatic experiences and endometriosis and found it absolutely. And it's dose dependent in a way. So we know from research that the more traumatic the experience, the higher levels of pain that women get, both with endo and also pelvic pain. So you've got to think about what this is, right? If I look at this from more of an energetic level, you know, when there's trauma here, there's going to be this locking down. Yeah, there's going to be this guarding, this locking down, and this storage of the stuff that's in that area of the body. And for women, even if we weren't sexually assaulted, which is so high, such a high percentage, we also have a lot of stuff around shame, around our sexuality, shame, fear. There's not a celebration of being a woman. Yeah, it's a difficult thing. So a lot of us have this conditioning, which really makes it difficult to move through stuff like endo, because we do need to relearn to love our bodies again. And a lot of the time, by the time you get to this pain, you hate being a woman. Like imagine trying to treat a patient who's experiencing infertility, and there's this real, like whenever she thinks about her physiology and her reproductive system and all of that, she feels like she's a failure. She feels like her body's let her down. And these type of thoughts, conditioning can really actually impact your ability to heal. And I know that sounds woo-woo, but if you look at this evidence, it absolutely isn't, right? There's lots of evidence that shows us that this is something that we really need to be aware of as part of our treatment. The microbiome, the 2 to 3 kilograms of bacteria, yeast, etc., that lives inside of the gut, has been studied pretty extensively and is definitely linked to endometriosis. So when there's disruptions in the microbiome, so it's not in a healthy balance, and maybe the diversity is not good, or maybe there's overgrowth of certain things, it's going to lead to greater onset and more progression, so worse endometriosis. Okay, and as I said, there's been quite a lot of research on this. And now we're starting to find research that looks at bacteria that's actually happening in the uterus and around that area and what's happening. And this came out last year. It's pretty new, and it looked at Fusobacterium, and it showed that infection facilitates the development of endometriosis. And there's been only a couple of studies, one of them in humans, that just found that way more people had this bacteria. So 64% of patients with endo versus 10% of controls had this bacteria in their endometrium. How interesting. And then they went on to do some mice studies that found that when they had this bacteria in there, it definitely established endometriosis in them. So this is pretty groundbreaking. I've seen 2 patients already. So we do a lot of microbiome testing at the Shift Clinic. So we do like microbiome mapping and digestive stuff because it's, as you'll see, it's really important to that part of the picture. And I've definitely at least seen 2 patients with endo with this bacteria showing up overgrown in their gut. Okay, so we can't test the endometrium in Australia yet, but it's definitely shown up in their gut. So this is a thing for sure. Watch this space. Great. All right. So that's a bit about the what. How do we heal? How do we heal from this condition that just can seem so all encompassing? You know, one of the things that my mentor, Kerry Bone, says to me was that you're not called a patient for nothing. And with endo, you do have to be so patient. And the women that are going through this are absolute freaking champions. Like they're so strong, so powerful. Like to be going through this and still standing and still showing up is a feat on its own. So to get into this space, this isn't something that's going to be fixed in a couple of months unless conventional interventions help. So if you see a doctor, you might get a laparoscopy, put a marina in, happy days. Maybe you don't notice anything ever again. Maybe that's like just saved your life, and it can happen. On the other hand, you might have the surgery, get the marina put in, you're constantly spotting, you actually have more pain than you did before. And then you're like, well, what do I actually do about this now? Where do I go from here? So conventionally, laparoscopic surgery is the number one. Hormones, yep. So either hormone replacement or hormone suppression. So you're either going to get put on the pill or you're going to get put on, some kind of thing that sort of puts you into menopause. Marina is a really common one. And if it works for people, fantastic. Maybe just non-steroidal anti-inflammatories like Panadol, Nurofen. And in extreme cases, it's a hysterectomy. Yeah. So that's sort of the medical route. Sometimes this will work. Often there's going to be recurrence. The naturopathic approach looks at the landscape, right? So we're more interested in understanding what are all the parts that make you you that have led you to be where you are today. In an ideal world, I like my patients to be treated by us for 3 months before the laparoscopy and 3 months after the laparoscopy. And what does that mean? It means we're working on some of the risk factors that caused it to happen in the first place. So imagine you've had this endo growing like since you were 13 years old, and then you get to 25 and you finally have a laparoscopy and they go in and they remove it. What's different? What's different? And they can never get every single cell, right? It's difficult for that to happen. But what's different in the environment, in the physiology than what was there for it to be able to develop in the first place? And that's what we're thinking. Like, how do we change the environment so when you go in and you do that surgery, things will be better? So the first thing we want to do is understand that landscape. And the diagnostic that we do is incredibly thorough. We're extremely curious. We order way more testing than the doctor does, and we look at your testing a lot differently than the doctor does, right? So once we have everything, we're like, right, well, what are all the pieces that we need to look at? The second part is we want to support any areas that are problematic for you. So if gut's an issue, we need to do that. Immune system, nervous system, endocrine system. Like, what are the other areas that need to be addressed in order for us to really understand that whole landscape? We want to work on hormones. So excess estrogen and the wrong types of estrogen are linked with endo. We want to make sure we address that. We want to reduce inflammation, both using supplements and diet, which we're going to talk about. That's a really big one. See, conventional anti-inflammatories are not risk-free. So you can't just take Panadol and Nurofen all the time because it'll damage your gut ultimately. So we need to have anti-inflammatory solutions that are sustainable and long-term. Some of them through the diet, but probably supplemental as well. Stress is a massive part of endo, massive. These different factors change for different patients. So as I said, I had that patient where her bowels were the main thing. I've had so many clients though that when we get their stress under control, the endo symptoms are way better, right? So supporting stress is important. And we do that both by using interventions, herbal medicines, etc., to work on stress, but also teaching you how do you process stress? What's your mind doing? Okay, a lot of the stress that we have is what I would call internal stress. External stress is I'm busy, I've got deadlines. Internal stress is how am I processing that? And it might go something like, oh my God, if I don't finish that, then my boss is going to be mad at me. And what if I lose my job? And and all of these internal pressures and expectations that we're putting on ourselves that are causing your blood pressure to rise, your cortisol to rise, and for you to be in this distress. Okay, stress directly impacts the immune system, which we know is a problem for endo. It directly impacts inflammation, which we know is a problem for endo. It directly impacts gut health, which we know is a problem for endo. And it directly impacts hormones in your cycles, which we know is a problem for endo. So stress is a real core of any naturopathic treatment, actually, but especially for you guys with the endo. We want to detoxify endocrine disrupting chemicals. And I'm going to move on and talk about that just so we get through everything here. Some good questions there as well. We'll get to those. So do you do naturopathy? Do you do conventional medicine? I think you need both, honestly. It's for something like endometriosis, you need a really good gynecologist specialist that's working with you in that area. And then we can complement that really well. You know, for some of my patients, they have to be on hormonal therapy. Their endo is so bad, there's no way for them to get around that. So what do? We help with the side effects of that. We help to prevent problems and issues from that. Yeah. So there's a lot that we can do to support that process and work collaboratively. I just wish there were more great gynies out there. I really do. They're few and far between, but we've got our little list of people we refer to. Okay. How do we heal with food? There's actually quite a decent amount of research on endometriosis and diet. So I'm going to run through this pretty quickly because I want to make sure I've got time for your questions at the end. But what you eat absolutely impacts your endometriosis and how you feel. And in a general sense, when we talk about inflammation, when you're eating, you're often either feeding inflammation or you're reducing inflammation. So things that would feed inflammation, processed food, sugars, absolutely, gluten, trans fatty acids, so deep fried foods, stuff like that, food additives, preservatives, like those type of things are going to feed inflammation. On the other hand, if we eat foods like a whole food diet that's based on things like green leafy veggies, brown rice, a bit of meat, fresh fruit, nuts and seeds, some good quality oils, that's going to be very anti-inflammatory. The onion family is very anti-inflammatory. Ginger is very anti-inflammatory. Turmeric is very anti-inflammatory. The turmeric that we use in a supplement is about 45 times more potent than the powder that you can get. So, there's only so far it's going to take you, but it's definitely not going to hurt you to have more and more of these foods in your diet. Oily fish, okay, particularly small ones are better. Fish is a dilemma at the moment for me because as a naturopath, it's something I've always recommended, because it's healthy, you got the omega-3s, but all of the fish in the ocean is full of microplastics and PFAS and a lot of the things we want to avoid. So I don't tend to really overtly recommend people eat that much fish anymore. I still prescribe fish oil sometimes. As I said, we use like a special fish oil that's really good for inflammation for endo. But it's difficult, yeah, because how do you know that it's clean? How do you know what you're getting? Green leafy veggies are anti-inflammatory, all of them. It's green, it's a leaf, it's probably good for you. And cruciferous vegetables, which are also very good for estrogen clearance, which I'll talk about in a minute. There is research that shows that if you eat a gluten-free diet, your endo will be better. I know it sucks. Gluten's an inflammatory molecule. It activates the immune system. So I recommend most of my patients go gluten dairy free while they're healing, largely, right? These foods make it difficult to heal. Dairy is interesting, okay? It's casein that does it. In particular, the A1 protein, which is in all the milk, cheese, etc. that we buy. It induces an inflammatory response. So we know for any autoimmune endometriosis stuff that having a casein and gluten-free diet is a good idea. So that means you can't have lactose-free milk. It still has casein in it. So there's an episode of the Shift podcast that talks about gluten. I would highly recommend going to listen to that for more. But yeah, if you can go gluten-free, it's going to be a good thing. Immune foods that are high in vitamin C, berries, citrus fruit, kiwi fruit, pineapple, papaya, buckwheat, onions, capsicum, bioflavonoids, berries. Berries are really one of the best endo foods you can have. So if you could do like a quarter of a cup a day or frozen organic berries, happy days. Blueberries, raspberries, any of them are fine. Not so much strawberries, the other ones better. Garlic is great for the immune system and your gut. Shiitake, oyster mushrooms. Actually, there's research that even usual normal mushrooms are good for your immune function. So mushies are a good one to have in there. Anything that's colorful and vibrant. I used to get my clients to do this exercise where every meal they took a photo and then they put it into a collage app with like the 50 photos over the week or whatever. And I got them to have a look at it visually. What does it look like compared to the week before? Is it vibrant? Is it colorful? Is it rainbow? Or is it brown and yellow, right? And that's a really easy experiment to know, are you getting lots of antioxidants and good things in through your diet? All right, a little bit about estrogen. High estrogen doesn't cause endometriosis, but it contributes to its growth. And we know that women with endo tend to have high estrogen. A lot of women tend to have either high or low estrogen. You know, it's just our hormones are pretty whack. When we're stressed, our hormonal system, reproductive system is the first to go because the body says that's not important because I don't need to make a baby right now. I need to survive. So hormones are easy to get out of whack because of the synergy between them. And if you're not sure, if you don't know much about that, go start listening to season 2 of The Shift. In the first episode, I talk about this interplay and this synergism between everything. So with estrogen, really what we want to do is do some comprehensive testing for all of your sex hormones. So for my endo patients, I often do a urinary profile, either a Dutch test or through another lab. And what it looks at is the 3 types of estrogen. Your blood test only does one, estradiol. This looks at E1, 2, 3. And then it also looks at 2,4,16 hydroxyestrogen to show if it's going down a beneficial pathway or a more of a proliferative pathway, which is good to know for your cancer risk as well. And then it looks at progesterone and cortisol and stress hormones and all of that stuff. So it's very, very comprehensive. So the reason I do that is it tells me exactly what I need to do for that patient, right? I can guess. I can be like, oh, like you've got breast tenderness and you're putting on weight and maybe like you're a bit hormonal and your periods are heavy, your estrogen's probably high. But you can never really know unless you do proper testing. So symptoms give us a baseline of what changes. So month to month, we'll be able to tell if our patients are improving or changing. But hormonal things take a long time. So for something like endo, I really want to work with someone 12 months minimum, probably. 6 is great. But after 12 months, I know we've made some good headway. And at the start of that period, it's going to be more intense. So we might be working with you and seeing you every 2 weeks, 3 weeks, 4 weeks. But by the end of that 12 months, you may only be having an appointment every 2 to 3 months. But it's going to take time for your body to really get those deeper changes. And while the symptoms might be slow to change, we'll see it showing up in the bloods and we'll know, oh, we don't need to work on estrogen clearance anymore because it's healthy and normal, right? So having the right testing, I think, is really important to understand exactly what we're dealing with. It's very, I know a lot of people or doctors might think naturopathy is woo-woo or it's extremely precision medicine. It's individualized, it's specific, it's holistic, it's looking at the whole picture, but everything we do is based on the specifics of what's going on for you in real time. So we might treat you for a month and then go, all right, well, we don't need to do that anymore. That's done, or that's looking good. And we're constantly changing and adapting. Whereas the conventional treatment's more like you see the doctor, you're on the pill, off you go. It's easier in a way. But I think what we do is more impactful in the long term. So we want to balance estrogen, right? So we can use herbs, we can use dietary things to do that. But there's lots of foods you can eat to help with estrogen metabolism. And these aren't going to lower a low estrogen, right? So it's safe to do for anybody. Cruciferous veggies, cabbage, cauliflower, broccoli, Brussels sprouts, rocket, watercress, kale, all of these foods help your liver to metabolize estrogen properly. Okay, and they're also anti-cancer and good for other things too. Fiber is going to mean if you have a diet low in fiber, especially if you're constipated, huge links between endo and constipation, by the way, if that's you. And the reason it happens is, well, what comes first, right? If you're constipated, you can't clear toxins, you can't clear hormones, you'll end up with higher estrogen often because you'll try and excrete it and the body will reabsorb it constantly. So when you have chronic constipation, it will be really difficult to help your endo, but it'll make your pain worse because everything's blocked up in there. So if you're constipated, we would treat that first before anything else, right? Because we need to get that moving. So fiber, it stops you from getting constipated, but as you excrete toxins and excess hormones and things into the bowel, that fiber will bind it and take it out of your body. So fiber is more important than any fancy supplement you're going to buy. If there's one thing you can take from tonight and it's eat more fiber, then happy days. And if you're eating fiber and it's upsetting your gut, it means there's other problems going on. You probably need to see us. Xenoestrogens and endocrine disrupting chemicals. They're estrogen-like substances. They interfere with the estrogen receptors and they are bad news. We're starting to hear about them on mainstream media. I've been banging on about this for about 20 years, right? Pesticides, herbicides, plastics, pollutants, they're in everything. Everything. All of us have detectable levels of these in our body. All of us have detectable microplastics in our body. All of us, right? And you consume, I think it's like a credit card worth of microplastics a week through your food supply, right? Which is a topic for another one. I won't go into that because we'll get a little bit stuck. But this is one of the big things that we're educating people on and helping them to get out of at Shift, because there's no point just taking supplements if you've got these toxins coming into your body all the time. There's research that shows that when you were in your grandmother's womb, which you were, so think about it, your mother was in her mother's womb and she had her eggs in her ovaries when she did. So you were inside of your grandmother's womb before you were born. Your grandmother's exposures can impact your reproductive health now. Okay, so this is a huge, huge, huge area that we need to have a look at. Phthalates are found in fragrances, soft plastics, flooring, lots of different things. But getting rid of anything in your bathroom that says fragrance or parfum on the label will eliminate a lot of these. So after you get off the webinar, go and have a look and then check back in with me and let me know what you find. Bisphenol chemicals, and I say that not just BPA because it will say BPA free, it has other bisphenol chemicals. There is no safe plastic. Okay, so it's just marketing. So they're like toxin free, blah, blah, blah. All plastics leach into water, and if it's not BPA, it's going to be something else. Coffee cups lined with plastic water bottles, canned foods, anything in a can. You know, if people are drinking Coke and stuff all the time, that's lined in plastic. UHT long life milk is also lined with plastic. This is the depresso bit, but you can avoid a lot of these anyway. Okay, so avoiding them is around things like going organic. It's not using things like cling film and plastic containers. It's trying to use glass and stainless steel as much as you can. Definitely never, 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 ever use plastic in the microwave, please, and never drink hot things out of plastic if you can help that. That's really going to help you. Some of these will get excreted from your body really quickly. Others have a half-life of decades. You know, so we could talk, as I said, we could talk about this a lot. There's an episode of The Shift in season 2 on this that goes into it in a lot more detail. There's also a good one in season 1, which is more gut health related. Okay, good. We're going good. Good questions. I can't get to those. Okay, synthetic fragrance. Sorry, my clicker's a bit slow on this program that I'm using. Okay, on the flip side, there's foods that we can eat that are phytoestrogenic that have more of like an estrogen balancing effect. Soy falls outside of this. Soy can actually push up an estrogen. Like if I have soy, I get big boobs and I get fatter, like legitimately, if I have a bon soy latte every day. And that happens for a lot of people. But other legumes, so lentils, chickpeas, beans, etc., are really, really balancing. So they're really good ones to have in the diet if you can tolerate those. They're also high in fiber. Flax seeds and linseeds. So one of the dietary interventions that I use for my patients is I get them to do 2 tablespoons of freshly ground flax seeds every day. And you could do that in your cereal, or you could do it like in some coconut yogurt. You can even just put it in a glass of water and drink it down. But that's actually backed by studies to help to balance hormones out if you do that. And it's high for fiber. It's good for gut health as well. But yeah, not so much soy these days. I don't recommend that a lot. Okay. Other research has just found that like having too much red meat, processed meat is maybe not the best thing. It's not something I bang on so much about. I'm more interested in getting rid of sugar, getting rid of gluten, getting rid of dairy, and eating lots of green things. And I think that's kind of enough. Yellow vegetables are good. Alcohol and endo, not great, unfortunately. So you want to keep that to a minimum, especially beer, which is estrogenic because it has hops. Hops is estrogenic, unfortunately. So ways that you could do it, you could do things like hummus, and make it as a dip, because you could put garlic in it and lemon juice, and that's really good. Tahini is also really high in calcium, so good for like bone health and stuff. Adding split red lentils to your soups and casseroles. So if I do a pumpkin soup, I just throw in some split red lentils. That gives me some phytoestrogens and some fiber. So that works really well. You could try making your own baked beans for breakfast, like by cooking beans up, etc. Curries are really great because all of those spices are just really anti-inflammatory. So that's a good way to go. You could include them more in your salads. You could do lentils instead of mince in your spaghetti bolognese. So just a few ideas. You might just need to branch out a little bit. Whole foods, essentially. You can't go wrong if you have a whole food diet, because whole food diet is naturally devoid of sugar. It won't have a lot of gluten because most of the gluten food we eat are highly processed, made of white flour. They're not whole foods. So, just making your own foods from scratch are kind of the way to go. Fresh juices might be good just for alkalizing and that kind of thing. All right. We've got some good questions. I'm going to get to those in a second. But first, I want to talk about how do you make the shift, right? So I have a company called Shift. And the reason that I name my podcast The Shift and I name my business The Shift Clinic is because in order to make a change, we need to shift our mindset, habits, behaviors, and beliefs. So we're not going to get the same result doing the same stuff that we used to do. So we have a Brisbane clinic, but most of our patients are virtual, actually. So we've got a few across the globe, but most of our people are across Australia currently, probably 90%, maybe 10% abroad. And we've helped about 15,000 people. And the reason that I've developed the clinic the way that I have is, I guess what I got really curious about was, why did some people get better and other people don't? I talk about this on The Shift. Why do some people make the shift while others don't? And a lot of it is to do with not understanding their landscape. So just not having the proper diagnosis, not getting the right support, and not being able to ride the waves that come with the process of healing. So always in a chronic health healing journey, it's not going to be linear. So linear means every day I'll take my herbs and then I'll get better and better and better until I reach my goal. It's not like that, because you're not a robot, you're a human. So when you're trying to heal endo, what you'll find is you'll have some good things, you might have a few good months, and then you might have a regression, or you'll be doing really well and then you'll get a new job, or you're really stressed, or you have a breakup and you go into the stress and the bad behaviors and habits that come around that derail you, and now you're back to where you were. What I would say is it's kind of normal to an extent. It's how we navigate those ups and downs that really matter. So the way that I've evolved this over kind of the last 10 years at the Shift Clinic is, rather than just treating people ad hoc and using a see how you go approach, we will actually project manage you through this process. So we work with people through a natural health membership where literally we will map out what you need, and it's quite hands-on. So rather than just going, see you in a month, try these things. If they work, they work. If they don't, they don't. Everything that we're doing is looking with the result in mind. So if things aren't improving, we're collaborating, we're working with you, we're trying different things, we're doing more testing, or we might even just know from our expertise that you haven't been doing it for long enough and you just need to keep going. And for me, I mentor other naturopaths as well. Like I wear a lot of hats with that. But a lot of the time, it's just knowing what to do at the right time and doing it for long enough for it to take effect. So in our memberships, we're working on all the different parts of the landscape, right? And that could be the physical landscape of gut health, getting you sleeping properly, but also maybe the emotional landscape and understanding, like, how am I working internally, and am I holding on to things that I don't need, and how do you move through that? So it's part of it is using an intervention to help you to heal yourself. So we're not fixing you. We're just putting some things in place so the body comes back into equilibrium, which is what it's always trying to do. We're working with doctors and doing that side of things. We're looking at testing and collaborating with that. But ultimately, we're teaching you to be your own doctor. How do you know what you need? How do you self-diagnose and get yourself to a place where you need to be? And I think that's what I love most about this membership process. So the first step is to working with us is this thing called a discovery and diagnosis. It's 90 minutes, it's $260, and this is where we deep dive into your entire landscape. So we want to know your story. We want to hear what's been going on, where it started. We're going to talk about your gut, your immune system, your mental health, like all of the different parts of you. What are you eating? What are you doing day to day? So once we have this landscape, we can then do a really thorough diagnostic. So we'll take all the testing that you've had done. Okay, this is actually what it means to us, because a doctor might say you're fine and normal. For us at the Shift Clinic, we have specific ranges that we know are ideal. So I can know that your thyroid is not great before your doctor will. Yeah. So we look at all that data and we give you this diagnostic. So now you're like, okay, well, probably I've got issues with my gut health and that's contributing. I can see these immune symptoms here are a big thing for me. So I know immune system's a problem with endo, but I've also got a bit of eczema and a bit of hay fever, and maybe that's contributing here. Okay, my thyroid doesn't look like it's suboptimal. I'm not getting enough sleep, so that's going to impact me. So now you have information to empower you to do something different. You may choose at that point to go, help me, I want to become a member, and we're going to do it together. Or you might take that data from the discovery and diagnosis and go, you know what, I've got what I need to move forward here, and I'm going to try by myself for a little while, and then you might re-engage at a later point, or you might just do the dietary things and just take that and use what you need. But this is really good value. We've never, ever, ever had a complaint of a D&D. If someone going, oh, I didn't get much, or it was too expensive or whatever, you'll walk out like just with some way more clarity and understanding what's going on for you. So as part of this masterclass, we do have a little deal. So we're going to do $70 off the discovery and diagnosis. What I might do is I might just pop that in the chat. So there's a link to like a page that talks about it. So while you're here, just click on that and it should open up in a new page, so that when you jump off the masterclass, you can have a look. But if you use that code 70ENDO that I've just put in the chat twice, apparently, you can get $70 off your initial appointment. So it makes it $190, total bargain, totally worth every cent. We've worked with thousands of people. Personally, I've conducted over 20,000 one-on-one appointments. So I kind of know how this process works. We've got 2 naturopaths, Bronte, Vanessa, both highly skilled, both highly trained in women's health stuff. But any case that's complex, I will have my eyes over it anyway. So we have 2 hours of meetings a week. On a Tuesday, we have our whole of team case management meeting. And this is where, if I have a patient that's complex, I want the team to know what's going on with them, because I might refer them for kinesiology or hypnotherapy or something else within the clinic. You know, we have a functional breathing practitioner. Sometimes she really needs to work with people to regulate their breathing and get them sleeping properly, etc. So we've developed this beautiful system where we have this team approach. And then on a Thursday, we have our whole of naturopathic team meeting. So the 3 of us sit down and we case manage difficult cases, basically. So we make sure that everyone's on top of things. We're looking over the blood tests. If anyone's not getting as good of results that we would like them to, we really brainstorm it and see if we're missing anything and see what we need to do. So it's very high touch. We don't work with dozens and dozens of people, right? We work with a small amount of people, but we go deep. Yeah. And our initial membership's 4 months. And in that 4 months, you know, there's a significant amount of change that can happen in that. And I think sometimes people might look at this and they might go, oh, like over a 12-month period, you might spend a few $1,000s on your health. But like, what does it cost to get one surgery? Like, what does it cost for, you know, you to end up getting a new diagnosis because you didn't sort out your gut microbiome? So I think if you took a step back, I think naturopathic care is something that will end up in mainstream medicine because it'll be cheaper than conventional medicine for the government, because the changes that we make are very long-term and very deep in what we do. Okay. I think that's all I wanted to share with you on that. So any more questions, let me know. I'm going to jump through to these questions. I'm going to pop the podcast link in the thing as well. This is the Apple podcast link. You can also find it on Spotify. Just search The Shift with Katherine Maslen. You'll find that. So let me get to some of these questions. Let me see. We've got no more slides. I think I'm done. Yeah, that's the podcast. You can see we've got 4.9 stars, 259 reviews. It is an excellent podcast. You will love it. And season 2 is all women's health. You can see it. We talk about endo. We talk about pain. We talk about environmental toxicity, all of that stuff. And this is just our Google review. So 4.9 stars, 135 Google reviews. We run a very tight ship and we get really good results. And I love working with endo because it's just one of those things. I think women have been navigating this thing and they don't know what they don't know. There's so many things that you can do for yourself to help. And I hope that's come across in this tonight as well. Okay. Chantel, I honestly just want to know how to live my life freely with this horrendous disease. So I think hopefully like this has helped you get something. Yeah. So it's understanding that the biggest one, I guess, with endo and quality of life is pain often, right? Pain and maybe heavy periods. So it's what's happening around that time. I've definitely had a lot of patients where they have pain all month or for like at least a significant amount of the month. But for most women with endo, it's that concentration, yeah? Like you get your period, it's leading up to, it's after, it's that horribleness around there. So anything we can do to mitigate that is going to help. So if you are one of our patients, Chantel, we do the dietary cleanup. So a lot of the stuff that we were talking about, and that might help. But the anti-inflammatories that we use are fairly potent, yeah, and they're not cheap, because initially we'll use very high doses to kind of get in and load, but eventually you won't need as much to get the same result. So by using a combination of things, we might use even 2 or 3 different anti-inflammatories as part of this treatment, and maybe some herbs that are working on hormones, etc. Very quickly, often we can at least get some change. So we're not going to go from a 10 to a 1, but we might go from a 10 to an 8 or a 7 within a couple of months. That's not uncommon. So there's definitely a lot that we can do. And as I said, it's just the technology of getting these medicines into our bodies is just better than when I first graduated, for sure. NSAIDs like Ponsans, safe to take long-term during the luteal phase if someone has pain and fatigue. NSAIDs damage your gut, basically, your gut microbiome long-term. So the answer is no, from a long-term perspective. So let's say if your pain's bad enough that you need conventional medication, right? Our herbs are no match for something like naprogesic or Ponstan, etc., because they're so specific in that pathway. Ours are more kind of working with your own body, turning things down, but they don't have side effects, right? So it means, yes, you might need more. Yes, the results might not be extreme, but they're not going to damage you. So maybe what you end up with, and often this is the case, is we use these natural interventions. There's still some pain, be like, oh, I actually only needed to take Panadol or Nurofen like a few times during the day, rather than having to have it for 3, 4, 5 days. So if we use less, that's going to help it. If we reduce the time frame, that's going to help it. Anything that helps is going to be beneficial and better than nothing. The other thing we would think is, all right, well, if these drugs are working and they're necessary, how do we support your gut in the meantime? So how do we make sure that the diet's there and that you have enough support and nutrition, and maybe even a probiotic that's going to help to mitigate the effect of that non-steroidal drug, anti-inflammatory drug. So Amber says, I'm needing help managing my symptoms and what to do to make baby number 2 easier. They're 2 surgeries and don't want to do that again. Yeah, it's difficult, isn't it? Because it's that constant cycling of surgeries. I mean, having the next baby would be helpful, because what I like doing, and this is, like I said, preferably 3 months before laparoscopy, 3 months after. People are coming into the clinic at all stages. I just had a laparoscopy and this happened. Like, you can't pick that. Likewise, if I was treating my endo patient, she got pregnant, I would continue to treat her during pregnancy, and we wouldn't use as much because we can't. But we would use pregnancy-safe things that are achieving our goals. And what I mean by that is we'd use herbs that are traditionally used to support hormones in pregnancy. Because when you're pregnant, it's like it's taking over this whole response, and it can be like a cure for endo in a way, because you're not having those fluctuations of hormones. It's changing things completely. So I would look at using immune support, like using these type of interventions throughout pregnancy, working on the microbiome during pregnancy, which is important coming up to baby 2 as well, and doing that side of things. So for us, we can work at any phase. So if we're looking for making baby at number 2, it's all right, what is it for you? Is it going to be pain? Is it inflammation? Is it heavy periods? Like, is that what's the problem at the moment? And so you're losing all your iron and then you have no energy. It's going to depend on your symptom picture, exactly what we're going to do, but we would definitely be able to help you navigate that. Absolutely. Chantel, will losing weight and potentially undergoing weight loss surgery help ease my symptoms? Maybe, maybe not. It really depends, because there's really no evidence that weight is associated with endometriosis pain. There's plenty of women that are overweight with endo that don't have as severe pain of people that are normal weight, that are living in a smaller body. So I don't think so. The thing you need to be cautious of with weight loss surgery, which often these days is a gastric sleeve, so they're cutting your stomach off literally, is that's going to lead to more acidity in the system. So if you don't have a stomach, you're not producing stomach acid. Acid is an acid outlet. So we make acid and then we secrete it into the digestive system and we release it from our body. So there can be more inflammation, more acidity, but it depends on what is your weight, what's the risk benefit of all of that. it's a complex conversation, and maybe one that's worthwhile having, Chantel, because if you haven't seen a naturopath before, maybe there's other reasons why you can't lose weight. Maybe it's working on the emotional aspects of things. I certainly would consider doing something like a virtual gastric banding, like hypnosis for weight loss, before going under the knife, because it can be really effective for people and it might save you thousands of dollars. My sister did weight loss surgery. First, she did a lap band, that got infected. Then she lost it. She's been through a lot, almost died. She's heavier than she used to be. She doesn't have a stomach now. Her weight stuff is emotional. My family has emotional eating, and she recognizes that now. So it's like, if you are an emotional eater, we need to look at that. Yeah. So like, it's what is the reason and causes behind it, I guess, is what I'm trying to say. What are realistic alternatives to hormonal birth control for someone with hormonal sensitivity or trauma-triggered responses to suppression? So this is a thing that we help people with a lot. They're like, my doctor said to go on the pill. That upsets me. I had one patient that was on a Mirena, and she wanted to tap out. She was getting married. She was like super depressed. Got the Mirena taken out. She's a completely different woman. Like, it caused depression in her body, literally. So for some women, the hormonal birth control and synthetic hormones, it makes them crazy. It just doesn't really serve them. So in our point of view, we then will come in with herbs to regulate cycles, balance hormones, work on inflammation. It's a bigger investment. You've got to work harder. I say when like naturopathy, I think it's the best modality because it's actually getting your own body to heal itself. It's teaching you tools. It's teaching you lifestyle, but you've got to do the work. You can go get acupuncture twice a week, and all you need to do is show up and sit on a table and get some needles in, and then off you go, like, no problem. With naturopathy, you've got to look at your shit. You've got to show up. It's confronting sometimes. You've got to be willing to do the work. But if you do the work and you're willing to give it a go, God, it's amazing what we can do. Is surgery the only way to reduce the endo? Yeah, basically, or severe hormonal suppression. So they'll put you on, like a menopause type induced treatment. Yeah. So it's like, it's turning everything off. Likewise, even with the hormone, like the pill, like the pill's flatlining everything. So it might just quieten it. But if you want to have babies at some point, you're going to get off the pill and then potentially it's just going to come back. So it's the way I would think about it is, if I had a tumor, like a lump in my arm here, like no matter how many herbs I gave you, it's probably not going to do anything. You just need to get a surgery to come in, get it out, and then we can provide the healing after that. So that's the analogy that I would use. Is there a reason I'm in pain every single day and just not during my cycle? Yeah, it could be because there's hormones happening all throughout the cycle, and for your particular lesions, there's inflammation happening all the time. So, and this is what I said, that you're in one of those extreme cases where it's like, what's going on with the body? There's this pain sensitivity. Like there's a complexity here. I think that the research, we don't know why, because as I said, you can have women with the tiniest amount of endo and a 10 out of 10 pain. You can have women riddled with endo and zero pain. And it's not random like that, but it happens. So how do we really know? Amber said her sister got a period earlier than she did. We talked about the psoriasis stuff. Is there any research regarding antibiotic-resistant UTIs and endo? Could the bacteria toxin antibiotic be a trigger? I haven't seen any research, but in clinic I've seen it. So almost like an interstitial cystitis type thing, and I think if it makes sense, right? There's bacteria there, there's overgrowth, everything's sort of connected. So we would say that the vagina is the guardian of the bladder. Yeah, so when there's issues going on with the vaginal microbiome, there's going to be more issues with the urinary microbiome. There's microbiomes all over the body. So I haven't read any research, but I wouldn't be surprised if I found some if I went digging, and clinically I've seen that happen for sure. Yeah. What do I do if my gynecologist doesn't believe in high estrogen? It doesn't actually matter because your gynecologist can't treat it, right? So this is the disparity we have. If you have high estrogen, your gynecologist doctor is not going to know what to do with that, right? They don't have any drugs to treat high estrogen, besides maybe like tamoxifen that you'd use for breast cancer or something, but they're not going to do it, right? Generally. But also, has your doctor tested your blood test at the appropriate day of your cycle and at the right time or not? That's a big issue as well, because your estrogen should be high when you're ovulating. So this is really a realm of the naturopath. because we can come in and detoxify estrogen and support that. And we understand that nuance. You'd be surprised the amount of gynecologists that don't really understand the menstrual cycle and the nuances of it all that well. Crazy. Since our hormones, Emma, since our hormones are often changing, how can we know if we are someone who has high estrogen or if it's part of the cycle that is lower? If you have a regular cycle, you would do it on day 21. And what I'm looking for, if we did a standard blood test, and I'm saying if you've got a 28, 30-day cycle, is we're looking for the ratio between E2, estradiol, and progesterone. Okay, so for starters, we want there to be a ratio about 10 to 1. So progesterone's 50, estrogen's 500. So I would look at that. But also on day 2, I also test estrogen. So that's how you have to test it at the right time of the cycle. And then once now you have a benchmark for treatment. So we can just begin to use interventions and to work on treating that as well. Good. Brittany, are there any payment plan options? So the memberships are a weekly fee, basically. So they start at about like $50, $60 a week, like at our lowest level, and they work right up to like $190 a week. And that would be if that's a pretty unwell person. And that would be if they were coming into the clinic and doing like acupuncture and like that's a lot. Most people would fall in between $50, $100 a week-ish, right, for memberships. So that's sort of the way that side of things rolls on, if that helps. Great. So I think that covers everything pretty well. Please come and say hello on Instagram. Follow me on Instagram, where you'll hear about more masterclasses, stuff coming on. By joining this, you would have got added to our list. I used to do 54 of these live in Brisbane a year, not just me and the team. But these is the kind of work that I really like to do. So probably the next masterclass we'll do will be thyroid. But as I said, come into the clinic if you need help. Even if you just do that discovery and diagnosis, there's no way you're not going to walk away from that with some value. So the link is in the chat there. You're also going to get a number of follow-up emails that will have the link and the offer, so it'll be really clear. But thank you so much for showing. Oh, hold on, one more question. If you don't have a period due to having an IUD, how do you find out where you are in your cycle? So if it's a Mirena IUD, there's a number of different things that could be happening. People can have a Mirena and be cycling, right, and not bleeding. People can have a Mirena and be cycling and bleeding. People with a Mirena can actually have their ovarian function turned off, in which case you would just do a random test and have a look and see where it's sitting. But because the Mirena is turning everything off, it can be a little bit false. So yeah, there's definitely nuance in when and where you test. Yeah, so we get patients all the time and they come in like, oh, my estrogen's really high. And I'm like, hold on a minute, when was your period? No, you're ovulating. Let's retest. We don't really know if that's Sarah, what's included in the membership? So the lowest level membership, you would do an appointment per month. But if you're doing a membership that's like $99 a week, then we would do actually 7 appointments over 18 weeks. And then you get complimentary check-ins. So if new blood tests come in or something goes wrong or your herbs are weird, then we can talk to you on the phone. So it's a high touch process. Yeah. So we're not just like, take this stuff and see how you go. You also get access to all of our online education. So all of stuff like this, but also a little bit more stuff, specific to members. But yeah, there's a lot of value in there, but essentially it's us. What you're getting is a structure to project manage you through your health. Yeah, basically. Yeah. And see, Sarah, the online membership that I'm developing at the moment, it's going to be $50 a month. And it's designed for people like you. And there's a lot more building out of it that I need to do, because with the membership hub that we have, there's enough to kind of get you started. But the naturopath then is sort of giving you the secret sauce. The online version of the membership, I need to do more of that. So it is something I want to be able to help as many people as possible. I would go back and listen to the podcast. There's heaps and heaps in there that you can do to make a change. And there's lots of free resources that we have that you can tap into, is what I'm saying. But for those of you that are ready, I would also love to welcome you into the clinic. So thanks so much for your time. If you're watching the replay and you've got any questions, feel free to email our team, and I will